The information in this presentation was put together by members of your community. We understand that COVID-19 has created a lot of stress on families, and as schools begin to open, we know that your child's health is one of your top concerns. Understanding how a primary care provider can support you and your family's healthcare needs is one of the ways that we can support you. In this video, we will be talking about primary care. Please look for our other videos on health insurance and telehealth. There have been a lot of definitions of primary care over the years. For the purposes of this video, we consider primary care to be the provision of healthcare services by clinicians who develop and sustain a partnership with patients and address a large majority of their patients' personal health needs. A primary care provider should be your first option for any medical condition that is not an emergency. A primary care provider is a healthcare practitioner who sees patients that have common medical problems or conditions. The person is usually a doctor, but a primary care provider can be a nurse practitioner or physician assistant. Pediatricians are primary care doctors who specialize in children's health, including physical, mental, and social health. Pediatricians are trained to diagnose and treat a range of childhood illnesses. Having a primary care provider allows you and your family to get individualized care from a provider who understands your or your child's unique medical history. You can see your primary care provider for routine checkups and non-emergency medical visits. Having a primary care provider can simplify healthcare visits because you usually see and talk to the same person for each visit. If a child has a mild fever, a cough, or a rash, a primary care provider can usually find the cause and decide what to do. Primary care providers act as your partner to help you and your children be well. An example of this would be if you are a single parent of several young children or your spouse or partner works night shift. Waking up in the middle of the night to find that a child is sick and has a high fever is a stressful event. Not knowing if you should wake up your other children and take them with you to the emergency room, or if you should call your spouse or partner and ask them to leave work, just adds to the stress. If you have a primary care provider, you could call their office and reach the on-call provider, who can listen to your concerns, answer questions, and help you decide if your situation is a true emergency, or if you can have your child rest at home until the morning and make an appointment with their office the next day. You will want to find a primary care provider that is part of your insurance network. If you go to a provider that is out of network, you may have to pay additional out-of-pocket charges. Some primary care providers cannot accept new patients, so you will want to ask this question before it's time to make an appointment. Look for a provider that has an office that is convenient to your work or home. Make sure there is public transportation or parking nearby. If there is a hospital you prefer, it can be helpful to find a provider who is affiliated with that hospital, but this is not necessary. If you do not have a primary care provider, here are some ways that you can find one. You can call your health insurance company to find out which providers accept your insurance. Although they have the names of the providers who are contracted with them, they may not know if those providers are accepting new patients. You can call a doctor's office in your town or your village, or contact Cayuga Health Partners Referral Hotline or Guthrie's Scheduling Hotline to find a primary care provider who's accepting new patients and will take your insurance. Be sure to have your insurance card and information ready when you make the call. If you get a voice recording, leave a message. Voicemails are confidential, and someone will typically call you back within the next business day. Your health and our community are important to us. We hope that you found the information in this presentation helpful.